What if I told you that one of the leading causes of blindness in seniors could be silently affecting you right now, without any obvious symptoms? Glaucoma is a sneaky condition that can slowly steal your vision, and by the time you realize it, the damage may already be done. But the dangers of glaucoma go beyond just vision loss. Today, we're going to uncover the 5 hidden dangers of glaucoma that you may not even be aware of. From increased risks of falls to the unexpected toll it takes on your mental health, these are the threats that most people don't talk about. And the scariest part? Many seniors have no idea they're at risk. Stick around, and we'll dive into how you can protect yourself and your loved ones from these dangers, before it's too late. You know, when it comes to senior eye health, it's easy to overlook certain things. We're so used to taking care of our bodies and checking off health boxes, but the eyes can often get left behind. That's where glaucoma comes into play. Glaucoma is a sneaky condition that affects the optic nerve, that vital part of the eye that transmits images to the brain. It's often referred to as the silent thief of sight, because it tends to creep up on people without much warning. It's caused by an increase in eye pressure, and the worst part? By the time the symptoms start showing, the damage can already be done. Now, why should you care? Especially if you're over 60, your risk for glaucoma is significantly higher. You see, as we age, our eyes go through changes. The drainage system in our eyes doesn't work as well as it used to, leading to a buildup of pressure. And here's the kicker: glaucoma doesn't just hit you suddenly. It's a slow process, often going unnoticed until it's too late. In fact, according to the American Academy of Ophthalmology, glaucoma is one of the leading causes of blindness in seniors, and it's estimated that more than 2.7 million Americans aged 40 and older suffer from it. So if you're in that age group, it's not something to brush aside. It's an eye condition that may take your vision without you even realizing it, and that's why understanding it is so important. Hidden danger number 1: silent progression. Glaucoma's first hidden danger is its silent progression. It doesn't show obvious signs, and many people don't realize they have it until it's well advanced. In the beginning, it often only affects peripheral vision, which is hard to notice since we rely on our central vision most of the time. The early signs are subtle. Maybe you're missing things on the edges of your vision or struggling to read street signs. These changes are often dismissed as part of aging. But the reality is, many seniors mistake glaucoma for normal vision changes, which is why regular eye exams are essential. If you wait until you feel symptoms, it might already be too late. In fact, over half of those with glaucoma don't know they have it, and by the time they're diagnosed, the optic nerve damage is already significant. The best way to protect yourself is simple: don't wait for symptoms. Make annual eye exams a habit, especially if you're over 60, to catch glaucoma early before it causes irreversible damage. Think of it like a crack in your windshield. Small at first, but left unchecked, it can block your entire view. Glaucoma works the same way, starting small and quietly destroying your sight if ignored. Hidden danger number 2: vision loss. Another hidden danger of glaucoma is vision loss, which can be the most frightening aspect of the condition because it's often irreversible. Glaucoma damages the optic nerve, the part of the eye that transmits images to the brain. As this nerve is affected, your vision starts to blur. Early on, this may only cause mild blurriness or slight peripheral vision loss, but untreated, it can lead to permanent vision loss. A common symptom is tunnel vision, where the center of your vision stays clear, but the edges become blurry or dark. It's like trying to navigate through a crowded room with only a narrow view. It makes everyday activities difficult. The World Health Organization reports that over 8 million people worldwide are blind from glaucoma, many of them seniors who didn't catch it early enough. The good news is that early diagnosis and treatment can prevent further vision loss. Medications, laser therapy, and surgery can slow or even stop the disease's progression, protecting your vision. If diagnosed early, glaucoma medications can help control intraocular pressure and prevent further optic nerve damage. Think of it like stopping a fire before it spreads. Early action can save your sight. Hidden danger number 3: increased risk of falls. Here's another hidden danger of glaucoma that you might not have considered: the increased risk of falls. As glaucoma gradually damages your vision, it can severely impact your ability to navigate the world around you. That's because glaucoma often causes a loss of peripheral vision, meaning you can't see what's happening in your side vision. For seniors, this can be a huge problem, especially when it comes to walking around. Imagine trying to walk across a room with limited vision. You can't see the chair that's slightly off to the side or the small rug that's rolled up on the floor. These kinds of obstacles can trip you up, and if you're not careful, a fall can happen. According to a study published in the Journal of the American Geriatric Society, seniors with visual impairments, including those caused by glaucoma, are twice as likely to fall compared to those with normal vision. The consequences of falling can be serious, especially for older adults. A fall could lead to a broken bone, a hip injury, or even worse, a loss of independence. And once your independence is compromised, it can affect your entire lifestyle, your mobility, your confidence, and your overall quality of life. But don't worry, there are steps you can take to reduce this risk. One of the simplest yet most effective ways to minimize your fall risk is by modifying your home. Make sure you have good lighting in every room, especially in hallways or near stairs. Remove any tripping hazards, such as loose rugs or electrical cords. You could also consider using assistive devices like a cane or walker to give yourself more stability when walking. And if you haven't already, consider getting a pair of glasses designed specifically for people with glaucoma. These can help you better navigate your surroundings and improve depth perception. Remember, when you take proactive steps, you can regain control of your environment and protect yourself from falls. Hidden danger number 4, mental health impact. Glaucoma doesn't just affect your vision, it can also have a significant impact on your mental health. Gradual vision loss can lead to feelings of depression, anxiety, and isolation. For many seniors, the fear of losing independence and the ability to do everyday tasks is overwhelming, causing anxiety and emotional strain. Studies show that seniors with visual impairments are more likely to suffer from depression. The National Institute of Mental Health reports that depression is more common among older adults facing chronic conditions like glaucoma. This creates a vicious cycle. As vision worsens, mood declines, which makes it harder to engage with the world. Another challenge for those with glaucoma is isolation. If you can't participate in activities you once enjoyed due to vision problems, it's easy to withdraw from social interactions, deepening feelings of loneliness and affecting your overall well-being. The good news is that there are ways to manage these emotional challenges. Support groups for glaucoma can be comforting, as they connect you with others who understand your experience. Additionally, if you're feeling overwhelmed, don't hesitate to talk to a mental health professional. They can help with strategies for managing depression and anxiety, like therapy or relaxation techniques. Lastly, staying socially engaged is key. Whether it's connecting with family, joining a club, or attending events, these activities help combat isolation and reduce the mental strain glaucoma can cause. Remember, taking care of your emotional health is just as important as taking care of your physical health. Hidden danger number 5, drug interactions and complications. The final hidden danger of glaucoma involves drug interactions and complications, which can affect many seniors. If you're prescribed glaucoma medications to manage eye pressure, you may also be taking other medications for conditions like high blood pressure, diabetes, or arthritis. The problem is, some of these medications can interact with your glaucoma treatment, leading to unexpected side effects. For example, certain glaucoma medications can lower blood pressure, which could be an issue if you're already on blood pressure medication. Similarly, some glaucoma treatments can affect blood sugar levels, especially if you're managing diabetes. In some cases, these interactions can even reduce the effectiveness of your glaucoma treatment. Research from the National Institute on Aging shows that seniors are at a higher risk of adverse drug reactions because they often take multiple medications. These interactions can be unpredictable and may lead to serious health issues like dizziness, lightheadedness, or fainting, which increases your risk of falls. To avoid this, it's crucial to communicate with your healthcare providers about all the medications you're taking. Always ask your doctor about potential interactions, and don't hesitate to mention any side effects like dizziness or fatigue. A thorough medication review can help ensure your glaucoma treatment works effectively and safely. So there you have it, 5 hidden dangers of glaucoma that every senior should be aware of. It's not just about protecting your sight, it's about preserving your quality of life, independence, and overall well-being. The sooner you understand these risks, the better prepared you'll be to protect your eyes and health. Now, the real question is, what will you do with this knowledge? Are you ready to take control of your eye health and prevent glaucoma from affecting your sight? Start by scheduling regular eye exams. Early detection could save your vision. And if you found this video helpful, share it with your loved ones. We all need to stay informed, especially as we age. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and turn on notifications so you never miss important health tips. And be sure to check out the next video on your screen for even more insights on staying healthy as you get older.